Well, good afternoon, everyone. Thank you very much for being here to get an update on how the state is responding to the coronavirus, what we're doing to prevent the spread here in Nebraska. This one, we're doing a little bit different, right? We're doing at 1 o'clock, not 2 o'clock, because I've got my radio call-in show at 2 o'clock. The rest of the briefs this week will be at 2 p.m., as they were last week. And because I've got to do the radio call-in show, we will try and keep this one briefer because I've got to get on the other call. So this one we'll try and wrap up in about 45 minutes or so. Also, as always, just want to remind everybody about our rules for staying healthy here, our 6 rules to keep Nebraska healthy. So everybody, what are they again? Trying to stay home, right? No unnecessary trips. Don't take any trips outside the house unless you have to. Just go out and get those essentials, right? Second, work. Try to work from home if you can. And if you're going into the workplace, make sure you're social distancing from folks wherever possible. So please continue to do that. Number 3, shop. But only shop once a week. And don't take the whole family. Just send one person in your household to go shop. And have a list, be efficient, get in and get out. Number 4, want to help kids socially distance. You can do this by having them play at home, avoid playgrounds, and avoid those, team sports, those big group activities. Number 5, help seniors, people in your neighborhood. Maybe you can go shopping for them or run errands for them or something like that. That will help them be able to stay at home and really kind of keep away from other folks, but don't go visit them in long-term care facilities. And then number 6, exercise daily. Find a great way to exercise at home or a socially appropriate way to exercise going forward. So again, our 6 rules here, we really want to emphasize that we want people over the rest of the month they're able to really focus on those things, to stay at home, stay healthy, stay connected. That's going to be important, especially as we look at over the next few weeks here, so we really want to put a huge effort into slowing down the disease here in our state. So please help us do that by following our 6 rules. Today it's been actually about a month since we started implementing that first rule, which was on limiting size of crowds of 250 people or less. We've seen great progress here in Nebraska, and I want to thank all the Nebraskans who are working to prevent the spread of coronavirus here in our state. Please keep it up. Next, I want to talk about food security. We mentioned last week what the state's doing with regard to SNAP benefits, how we're extending the recertification 6 months for anybody in April and May, and what we're doing to get the maximum allotment possible allowed by the federal government. To put that in perspective, if you normally were a family of 4, you get about $500 a month. This will take it up to $646, which is an increase of $146. The first payment for that went out April 11th. The second will come out May 7th. So we're getting those benefits out early to be able to help those families be able to meet their food needs. Now, one of the things that we have seen here in our state is that we have other places like food banks where people who are in need of food go. But it's been a challenge here with the coronavirus and all the other things going on here in our state to be able to keep those food banks and food pantries open. So we've got a couple folks who are going to be here today to talk a little bit about that. And I'm going to start off with Scott Young, who's with Food Bank here in Lincoln. And then Leia Noel will talk with Foodnet about what they're seeing out there in the community and how you all can help. So I'm going to start by calling up Scott Young and have him talk a little bit about Food Bank of Lincoln.
Thank you, Governor. Also, some notes about the Food Bank for the Heartland. There are 2 Feeding America food banks in the state of Nebraska, Omaha and Lincoln. Want to tell you about the 700 agencies that we serve all together across the state. We serve every county in the state of Nebraska. And about half of those distribution points are schools, which are now closed. So we've adapted mightily to a number of different situations and circumstances that we find ourselves in. During the pandemic, our network, Feeding America, has anticipated a 45% increase in food insecure people during the next 6 months. In the state of Nebraska, we have 223,000 food insecure people. If there's a 45% increase, that would mean 100,000 additional people who are struggling with hunger. If it's a 35% increase, which generally we trend lower than the coasts, that would be an additional 78,000 people that would need some food assistance in the next 6 months. We are seeing increases in both our rural communities and in our urban communities. There was a food distribution in Grand Island this past weekend executed by Food Bank for the Heartland that had over 1,000 cars show up. We've seen great spikes in our rural settings where we go out and pass out pre-packed bags, which is low contact, no contact. It protects our clients from infection and protects our staff from infection as well. One of our big challenges right now in food insecurity in the state of Nebraska is that resources are going down while the need is going up. The grocery stores where we pick up so much product, they're moving everything they have and then some. The food pipelines are starting to get a little bit awkward and kind of are choking up a little bit in terms of demand across the country. Food we order now may take 4 to 6 weeks to show up at our food bank. So we have great concerns, not only right now, but in the coming months. We are really concerned about how this summer may impact food insecurity in the state of Nebraska. The best way for folks to help is to go to one of our food bank websites, lincolnfoodbank.org. Food Bank for the Heartland is foodbankheartland.org, and make donations because we're going to be buying hundreds of thousands of dollars worth of food in the next 60 to 90 days to try and keep up with this increased need. And that's also a place where folks can go to get information about where the food distributions are. Both food banks are doing a great job of posting daily where they will be distributing food on those days. It's rough right now, and we anticipate it's going to get rougher over the coming months. Governor Ricketts mentioned the SNAP benefits and how that's all increasing. We have 8 full-time SNAP outreach workers who are manning the phones in their homes. They served 300 people last week with applications and hundreds more in terms of answering questions about the food stamp benefits that are available through the federal and state governments. So all in all, a difficult challenge for low-income people. You all have seen the unemployment claims from the last 3 weeks. I think they numbered over 67,000 compared to 42,000 all of last year. And a lot of those folks are going to show up on the doorsteps of the food banks in Omaha and Lincoln. So thank you. A lot of crisis for a lot of families and a lot of working people who are former working people now. So thank you.
Thank you very much, Scott. Again, we appreciate the work that you're doing there to help the folks in our community. Next, I'll call up Leia Noel, who will also talk about what she sees from the Foodnet standpoint. And Leia, maybe you could talk a little bit what's going on from your standpoint.
I do want to thank Governor Ricketts for the invitation to be here this afternoon. Foodnet is one of many organizations that continue to serve in the community in this most unusual time. Here's a basic overview of Foodnet, and this really relates to mainly Lincoln and the surrounding communities. But food is donated by grocery stores and other businesses, and volunteers give it away to those in need. During a normal week, we pick up nearly 100 different locations and serve 5,000 to 6,000 people. That would be approximately 240,000 each year. Foodnet sites are located in mainly this part of our state in Lincoln, Crete, Denton, Milford, and Seward. The work is done by volunteers, and I'm sure that there's some other similar organizations across our state who are also doing the same. In early March, when the information began to come out as to the seriousness of the COVID-19 virus, we adjusted according to the direction of our governor, the mayor of Lincoln, and our local health department. Throughout this time, this information has been consistent, decisive, and clear. The communication has been timely and has helped us continue our work with Foodnet. In the beginning, we immediately had some locations close due to the request of the host site. We also saw a reduction in our retired volunteer base as they are especially vulnerable to the virus, and the decision to stay at home and to stay safe was fully supported. In the weeks following, we have adjusted to having fewer sites open, and work is done by a smaller group of volunteers. We currently have Foodnet sites open every day except Wednesdays, But on Fridays, Saturdays, and Sundays, we have 3 sites open each day, which has been helpful when other food distribution sites are not as accessible. Having fewer volunteers has allowed us to maintain social distancing while working, and we have simplified our work as the food bank has done. We have switched to many drive-through locations, which limit our contact with the public. A few sites still allow clients to come into their building to pick up food, but these locations are strictly following the COVID-19 guidelines to keep everyone safe. Early on, we saw a slight decrease in our participation, especially because our elderly and those with ongoing health issues decided to stay home. However, many people do rely on Foodnet and other food giveaways. They rely on those under normal circumstances, and now as food supplies are needing to be restocked and more people are experiencing job loss or reduced work hours, we do expect that we will be serving more people in the weeks ahead. So how can the public in Lincoln area be involved? And I hope that you will apply this to other parts of your state, of the state. If you are in need of food, you are welcome to come to a Foodnet site. For Foodnet, there are no pre-qualifications in order to participate, except that you must be at least 19 years of age or head of your household. If you do know people in need and want to pick up food for them, please do that. We just appreciate you checking with your neighbors or family members or friends that you know of that might be homebound and that you could help them. And if you are healthy and are able to volunteer, some sites could use some extra help. So please call one of your local areas. For Lincoln area, you may contact us at foodnetlincoln.org. And finally, on a very positive note, we just want to thank the grocery stores and businesses that help us in our community and probably across the state. But it has allowed us to continue serving at this time, and we hope to continue to do that. So we just want to really thank so many people who have supported us around our state. Again, our website is Foodnet Lincoln, and you can also access on our Foodnet Facebook page. Thank you very much.
Great, thank you very much, Leah, and thank you for the work that you and your volunteers are doing as well. The couple of other things I want to hit upon before we get into question and answers. This is Line Workers Appreciation Day. Usually we do an event to show appreciation for our line workers who, there's about 1,800 of them that maintain our public power grids across the state of Nebraska. Obviously, with the current health emergency, we're not getting a bunch of people together to be able to do that, but I do want to recognize our line workers who are out there. We've got about 6,000 miles of transmission lines here in the state of Nebraska, over 100,000 miles of sub-transmission lines. These 1,800 folks are the ones who make sure that stays in order for us, especially when we have weather like we did over this weekend. They're the ones that go out there to make sure that we get that power restored if it's been knocked out. So I just want to say thank you to all of our line workers and all that they're doing to be able to make sure we continue to keep the lights on here in the state of Nebraska. Along with that, I want to just highlight something that has been called to my attention by our public utilities as well, that there are a number of scams out there with regard to unpaid bills. I want to remind people that our utilities will never call you seeking payment. They're not going to call and ask you to make a payment to have your utilities cut off, before utilities are cut off. And in fact, almost all the utilities in our state have stopped cutting off utilities during this emergency. So if somebody's calling you and said you need to pay your utility bill or you're going to be cut off, that's going to be a scam. Please don't respond back to it. So again, our public utilities have asked me to help get that word out, that they are not going to be calling you to tell you that you need to pay your bill or you're going to be cut off. Most of them have discontinued that anyway, but they would never do that, and it is a scam, so don't fall for it. Next, I just want to highlight some of the staff at the Greeley Nursing Home. There's 6 staff there that, since the middle of March, have been living with the residents at the Greeley Assisted Living Care Facility to make sure that they are not exposed in the community to coronavirus and bringing it back in. And while, every situation is going to be a little bit different. I do want to commend them for the sacrifices they are making to be able to make sure they keep the residents of that facility safe. So thank you very much to the folks there in Greeley. And then the schedule for this week, as I mentioned already, 2 o'clock will be the rest of the briefings that we have here the rest of the week. We also will be, or I'll also be on NET at 8:30 on Thursday night, as I have this past several weeks, doing a television town hall and responding to questions that folks bring up. And we'll have a number of other guests at that time as well. And with that, I'm going to go ahead and roll into our questions and answers. From Andrew Osaki at KETV, what are you hearing about food processing centers shutting down due to coronavirus concerns? And how safe is our food supply? What are some of the ways you have heard processing facilities are adhering to social distancing guidelines? Should food handlers be wearing masks? Is there anything that can, okay. And there's another one here about anything can be done to avoid wasting milk that is being dumped by dairy producers. So just in general, when you're talking about food processing centers, we have had food processing centers that have had people test positive. For example, in Grand Island, we mobilized a lot of resources to be able to do that testing, send additional people there to do the contact tracing to get people isolated. I've been on the phone with food processors talking to them about, actually I've been on with both management and union representatives talking about what we can do with regard to our factories to be able to make sure they continue to supply. I have not heard of any in the state of Nebraska that have closed down, though again I know that we've got a number that have had positive testings in their facilities. And for example, some of them, what I've seen them doing to be able to do it are having everybody wear masks, to taking temperatures of people who are coming into their facilities to make sure nobody's got a fever, putting up plexiglass walls between workstations to help create some of that distance or isolation or that separation, doing that in lunchrooms, spreading out lunchrooms. So there's a number of facilities that are doing a variety of different things with regard to how they can do social distancing in an environment that is very challenging to do social distancing in. But it's absolutely important we keep our food processing facilities going. This is vital to make sure we continue to have that strong supply chain here in the United States. Here in Nebraska, you know, we're the beef state. We feed the world, and it's important that we continue to do that we feed not only ourselves, but our country, and continue that strong supply chain. So we will continue to work with companies to be able to make sure we're doing all we can to keep those supply lines open. And is there anything can be done? Okay. Is there anything can be done with regards to the milk? And again, part of that, I've asked those questions as well. We do have some of our dairy producers that are dumping raw milk, not just here in Nebraska, but across the country. And it's a kind of a logistics issue, right? This is milk that was generally going to large consumers of it, like restaurants and schools and so forth. And so not necessarily meant for going to your grocery store. So there is a logistical challenge there. But we're going to continue to look to see if there's things we can do along those lines. But again, it's just kind of the nature of the supply lines on how that works. Jack Harms from KNOP, the governor's reaction to the outbreak of COVID-19 in Callaway at the Callaway Good Life Center. What type of support are they receiving? And again, I just want to compliment the two public health districts in working together with the state and Great Plains and North Platte. Mel McNay, their CEO, has just been a fantastic partner through all of this. This is a situation very similar to Carter House and Blair, in that we had a nursing facility that was having difficulty isolating their residents who were tested positive just because of the nature of the layout. And so working together with Great Plains and Loop Basin and West Central Public Health Districts, those folks were moved from the facility into Great Plains and North Platte to be able to help take care of them. So again, great cooperation by everybody around the state to be able to work, or to make that work. So I want to thank everybody who helped us address that situation there. And then Taylor, I think you had a couple of other questions?
Yes, Rob at KTV would like to know the status of people getting unemployment benefits. He said that there have been some long wait times and some people haven't gotten their benefits. Is there any background that you could provide?
So Rob at KETV wants to know about the unemployment benefits. We had John Alvin here last week describing that process. It typically, in a normal situation, would take 21 to 28 days for somebody to be able to get that first check. So you've got to keep that in mind in the first phase. Now, we have waived the 1 week waiting period. We've waived some of the other requirements, like you have to be looking for work. However, as we talked about last week, that there are a number of people who are, we're seeing record numbers of people apply. And so John is working to more than double the number of staff. We're looking to bring in volunteers from other organizations within state government, looking to outsource some of the things to companies to bring in some additional adjudicators to be able to help increase the process or get more people working on the process. So we are working to still stay within that 21 to 28 day time frame, but it's going to be a challenge. I know other states like Connecticut have said they're not going to pay those benefits for 40 days. So we're working through that to try and address the large demand that we have here with a record number of people. But again, just to keep it in perspective, even under normal circumstances, it would be 21 to 28 days before you'd receive those benefits.
Martha Stoddard at the World Herald wanted to know if you had a comment on Governor Cuomo's complaint that New York is receiving less per capita in federal relief than Nebraska.
So Martha Stoddard at the Omaha World Herald was wondering if I had comments on Governor Cuomo's comment that New York was receiving less per capita than Nebraska from the federal relief package. And, you know, I would just say that, you know, first of all, that is a federal issue, not something we, the state, get directly involved in. But New York's also received a lot of other assistance with regard to testing and all sorts of other resources as well that aren't coming directly through that bill. So New York has received a lot of attention and is getting a lot of the resources.
Christina at NET wanted to know if you had any other further comment on meat packers and whether you're planning to direct them to do certain things regarding social distancing.
So that was Christina at NET, was talking about meat packers and social distancing. And again, been working with a number of food processors, was on the phone with JBS, for example, I think Sunday through Thursday every day. I think Friday was the first day we didn't talk. But again, and got a lot of information from them with regard to what are they doing to be able to do more social distancing. I mentioned some of those things already with regard to taking the temperatures, the masks, the increased sanitation, the plexiglass to create more space within the workspace. So all these folks understand that they've got to work hard to be able to make sure that we can keep those plants open and continue to make sure we keep the supply lines for food here in our country strong.
She also asked if Central Health District Director said there's a strong possibility their local healthcare system could be maxed out. Is there a plan to accommodate people in the Grand Island area if they need to be transferred to other hospitals?
So the question, the follow-on question was, the local public health director in Grand Island has said that the local health system could be overwhelmed if too many people go, and is there a plan to be able to move people around? And the answer is absolutely yes, that we absolutely have plans to be able to move people if we need to make sure that we can accommodate. For example, some of the things we've done already is the state has invested in building out facilities at Midlands Hospital and at St. Eve's to create more space that we can move people to. And in fact, this is what we did when we had the Carter House situation. You may recall that. We actually, in Blair, moved some of the residents to Midlands to be able to help them with regard to, you know, making sure that they could keep that facility, keep all the people in that facility safe. So we absolutely have plans to do this. And Dr. Anton, I'm going to call you up just to see if there's anything else that you want to add to that with regard to, you know, the healthcare system and how we're managing it.
So yesterday I did talk to the chief medical officer at Grand Island, St. Francis Hospital, and they did have quite a few patients that were in the ICU. And one of the advantages for St. Francis and Grand Island is that it's part of the CHI system. And so they always have the opportunity. They have a surge plan in place, the CHI system, to transfer between facilities if that's a necessary step to take. So they have a facility in Kearney. They obviously have a facility here in Lincoln, St. Elizabeth's, and then we always have the facilities in Omaha too. So there's definitely plans in place to move, not even within the same health system, but even all the other health systems have agreed to cooperate as far as any need for patient transfers to be done. So I think that's one of the great things about being a resident of Nebraska. We have this great collaboration, great cooperation between all our health systems, just like the governor mentioned about what happened this weekend in Callaway and North Platte getting involved. So,
Thank you, Dr. Anton.
Chris at NTV would like a little more detail around our plans to work with the university to quarantine or isolate patients or individuals there. What will the process be like, and what do people need to do to use that resource?
So Chris was asking for more information around our plans to work with the university system with regard to dorm rooms. And I'm going to wait till we actually get ready to announce that program, when we get all the program fully laid out. Right now, what we have done is rolled out a program to be able to help, first responders and healthcare workers if they need a hotel room to be able to do that. And we have helped a couple of people, and we've got some learnings from that as well with regard to how we would implement that. For example, one of the things we want to do is, rather than the 800 number, is really trying to direct those people to go online to be able to help manage the number of people to be able to do that and make us more efficient with regard to it. So as we have more details about broadening it out to, say, the general population to be able to do quarantine and isolation, we will do that, but we're not prepared to do that at this point. We're still putting together some of those plans, and we'll announce it when we're ready to do so.
And finally, Bill at 1011 says Senators Urban and Halloran are calling for Nebraska to reopen its businesses and schools as soon as possible. They said the cost of the economy is too great, and death projections are going down, and we need to rely on herd immunity. Is that something that you're considering or agree with?
So Bill at 1011 was talking about Senator Erdman and Senator Halloran calling on us to open up the state as soon as possible and develop herd immunity and so forth. First of all, I agree with them as 100% that we want to open up the state as quickly as possible. The big key, again, is what we've said all along, which is about making sure that we don't overwhelm the healthcare system. And so that's what we're working to manage this to. We've got our, stay home, stay healthy here till the end of April. We're going to continue to focus on that for the, 2.5 weeks or so, a little bit more than we got left in that. And then we will look at what can we do to start loosening up some of those restrictions, and we'll do that gradually over time. But I think that if you go back and look at Grand Island, that's a great example of how quickly this can come up on you. Now, we knew, because the public health director was talking about, just the comment about how in Grand Island locally, that hospital could get overwhelmed and why we need to move patients around to be able to manage that. But think about how fast that happened. A week ago, when we were having the big spikes in testing positive, the hospital was not being impacted. So there's a lag effect there from that happening. So we saw the high test for positivity, and now we're starting to see the hospital getting more patients. So I think we need to understand there is going to be a lag between when you see some of this stuff and when it actually impacts the hospital system. And that's how we're managing this, to be mindful of the fact that we don't want to overwhelm the healthcare system. And that's what we'll continue to do, is look at how much hospital capacity do we have as far as beds, ICU units, ventilators, and all that, to make sure that we don't get overwhelmed as a state, and that we try to manage as best we can on a local effort as well. Any other questions? All right. Questions from the folks in the house here?
Question for Scott.
Scott?
When you say that the food chains are getting a little choked up, what do you mean?
Just the transporting of food around America right now is under great pressure in terms of demand. The food banks need the same food that all the retailers need, and so we're getting in line on those things, and there's price competition and issues like that because everybody's ordering a lot of food right now, and generally food banks depend on donated product, but as we go into the buying market, then we're swimming in there with a lot of big fish.
Well, Governor, you've had Kathy Sifkin in here, and you've repeatedly said the food supply is okay, so how do you reconcile these?
Well, and I'd certainly let Scott talk about this, but I think one of the things is that Scott's referencing, and correct me if I'm wrong, Scott, but don't you get a lot of food generally donated to you from grocery stores?
Absolutely, yeah.
Okay, so if grocery stores are selling everything they have, not everything they have, but if grocery stores are selling a lot more product, there's less product to donate to food shelters. So I think that's part of it, and plus we all know that one of the things we've talked about with Kathy Sifkin is about making sure we got truck drivers. We've waived some of the requirements with regard to those, and this is one of my first executive orders, waive the requirements on hours and weight limits on food trucks, because we knew there was an increased demand to be able to get that food moved from warehouses to distribution centers to the grocery stores or wherever it was going to be. So I think the fact that the supply chain is seeing a lot of volume is not surprising. We talked about that weeks ago, and that's why I issued that executive order to release some of the restrictions on things like hours of operation and weight limits and so forth. And Scott, I don't know if there's anything else you want to add.
Food is there, it's a matter of logistics.
Food is there, matter of logistics. We've been looking for truck drivers too. We've talked about that as well.
I had another question for
Yeah, Lee.
Scott, if you don't mind.
Sure.
In regards to your larger areas that you guys serve, what is the demand that you see
It's not unusual for us to see a 50% increase in expected demand at some of the distribution points at which we're visiting. And so we're having to pack our pre-packed sacks, which is what we're distributing right now, low contact, no contact, drive-through events. We're having to pack for more than we usually see, in some cases up to 50% more, and hope that that's enough.
You saw the 1,000 cars in Grand Island. Is that a reasonable amount that you guys can provide, or were there people that you actually had to turn away?
The food bank for the Heartland ran that distribution. They had packed for 750, and they had 1,000 show up, so I believe they had to turn people away on that.
And that's not uncommon, I'm guessing, to see at other locations around the state where you're at that lack of food?
When we've had that happen in Nebraska City a couple of weeks ago, and we repacked what we had and gave more people less food, which is one of the choices.
For him or for me? Okay. Thanks, Scott.
Was herd immunity ever discussed when you put together the state's plan?
Excuse me?
Was herd immunity ever discussed as an option when you were talking about formulating a state plan? Or
So-
why was it rejected?
So Paul's question was, herd immunity ever discussed when we were talking about a state plan? No, it wasn't talked about from that standpoint of part of our plan. I mean, it's a term. Well, I don't really think it's even really an option as far as a plan, depending on what you mean. I think we really have to talk about specifics. What is the specifics of your plan? Now, do you mean, are people going to be exposed to this over time? Yeah, people are going to be exposed to this over time. What we're trying to do is make sure we slow that down so that we don't overwhelm the healthcare system. That's what we're really trying to do. And I think if you look at, for example, some of the models like the IHME one, you've seen that happen, right? They're starting to show that things are spreading out and slowing down. And that's what we want, to make sure that we don't overwhelm the healthcare system. But as far as a plan, there was no, it's not, herd immunity is not a plan, right? That is something that happens over time. And it's just the question is, how quickly does it happen? If it happens too quickly, you're going to overwhelm your healthcare system. You had a brilliant question. We'll come back to you, Paul.
That is the goal. I mean, to get enough people who are immune to it, that it just won't spread out.
Well, again, the goal is not to overwhelm the healthcare system. This is, coronavirus is a virus. It's like the flu. You can't stop it from coming. You can slow it down by the measures we're taking, our 6 rules, for example. And that's the whole point, is to slow it down so it doesn't overwhelm the healthcare system. And then eventually develop a vaccine, like we've done for the flu, and antiviral medicine, like we've done for the flu. So there's a lot of analogies about how long-term we'll fight coronavirus to what we do right now with the flu.
I remember my question. Are you
Okay.
concerned that those kind of calls for something else like herd immunity could undercut what you're trying to do?
So am I concerned that those kind of calls for things like herd immunity are going to undermine what we're trying to do? Well, I think that what we want to do is, again, focus on what we are trying to do, which is slow this down so it doesn't overwhelm the healthcare system. I think those senators would agree. We don't want to overwhelm the healthcare system. And that's what we're going to manage very closely, is looking at data to make sure that as we start to loosen things up, we don't overwhelm that healthcare system. So far here in Nebraska, again, we've had so many people working very hard to be able to slow that spread of virus here in our state. Every Nebraskan can be a part of that. Every Nebraskan has a personal responsibility and a civic duty to be a part of that by doing all the things we've talked about, like washing your hands and staying home when you're sick, 6-foot physical distancing, all that sort of thing is what we can all be a part of to slow down that spread. And when we do that, we slow it down, and that's what's happened here in Nebraska. We haven't seen our healthcare systems getting overwhelmed, and that's what we got to continue to focus on. Yeah, John.
As it gets later in the month and you're deciding on what restrictions you want to loosen up, how much input from the federal government are you going to take with like the president's administration on what they want you to do, as opposed to maybe what you think is best for the state?
So the question was, as we get into the month of, get toward the end of the month of April, and we're looking at maybe loosening some of these restrictions, how much guidance are we going to take from the federal government? It'll be one of the sources of data that we have. We'll see what the CDC guidelines are with regard to if they come out with things, if they've got data on a county by county basis, like they've talked about maybe providing. That would be great information if they could get that to us. We'll also work with our folks at UNMC, our local public health directors, Dr. Antone. We'll look at a variety of different sources to kind of measure this, and then we'll also look at other states. We'll look at other countries. and we'll see what they've done and how effective that was. So we'll actually cast a pretty wide net with regard to the types of data we're looking at to make those decisions. And then it's something that also we'll continue to monitor, that even as we loosen some of those restrictions, we'll look very carefully to make sure we're not running in danger of overwhelming that healthcare system.
Do you expect that they'll give suggestions on what you should do?
Do I expect that the federal government's going to give suggestions? I expect they probably will, but I don't know that for a fact. It's just based on, they gave us expectations with regard to, you may recall, again, a month ago is when I implemented the 250-person rule. And then the CDC came out with the 50-person rule and the president the 10-person rule. So I do expect to get that kind of guidance just because they've given it the past, not because they've told me specifically they're going to.
Governor,
Yeah.
just looking at DHHS on their COVID map, it looks like 23 cases right now are not even reported in any of the counties. Do you know why that is?
Excuse me, why there's 23 cases not attached to a specific county?
Yeah, basically, just looking
Yeah.
at the map, like it only had like 790 on the map and then 814 reported total. So I was just wondering if there's a discrepancy on which counties they're in.
Sure, so the question was, so the question was, gee, there's 23 short on your map versus what you got total counting. That's exactly the same number that was reported between noon and 6 p.m. yesterday. So I wonder if there's just a little bit of delay between those cases getting reported on the overall number versus getting incorporated into the map. There just may be a little bit of a time delay. It's actually one of the things Dr. Anton and I are talking about is maybe standardizing when we put that data out so we just can make sure we got one number that doesn't get confusing.
And kind of just going back to like herd immunity and like maybe going to that in the future, is that something we could see here in Nebraska, or is that high likelihood or like low likelihood? Where do you see that at?
Well, again, the question was herd immunity is going to come here to Nebraska. Well, herd immunity is just this idea that eventually people get exposed to the virus and develop antibodies to it, and so they develop a level of immunity. And that happens today, for example, with the flu. As we, get exposed to the flu through the different strains of it and so forth, we all develop kind of an immunity to it. And then we also have vaccines to be able to help us develop that immunity. So, again, the coronavirus is a virus, just like the flu virus. You can't stop it, but you can slow the spread of it. And that's what we're focused on, is slowing that spread. Now, over time, will people start getting exposed to it, well, we hope slowly, so it doesn't overwhelm that healthcare system. But that will happen over time. What we're all about is making sure that happens slow enough that we don't overwhelm the healthcare system. Yeah, Lee.
In regards to the DHMs being lifted here within a month or two for different areas around the state, here in Lancaster, we see the DHM being lifted relatively within a month or so, right? When is the reevaluation period for that, and how do you try to make it so people across the state have an understanding of when they can expect those changes to come, whether it's all at one time or you're going to do an adjustment all across the state?
Yeah, so the question was, we got DHMs that are in place at different times, right? Douglas County's like April 30th, Lincoln's at May 6th. A lot of the other states, May 11th, or the rest of the state or other parts of the state are May 11th. And when we're looking at loosening up those restrictions, what can we expect with regard to that? Well, we're going to continue to evaluate that data from now until we start approaching the end of some of those deadlines. And then again, as I said, take in all the data that I talked about earlier, consult with all the folks that we've been talking with already, and make a decision. It'll be tough to be able to tell exactly what people can expect because we're still collecting data right now. So I can't set an expectation right now. But one of the things that may happen is that we decide to change those restrictions again in different parts of the state at different times. Just like we rolled them out, we may start taking them off at different times as well. But again, we're going to look at the data, see what's happening in our hospital system, look at utilization rates and so forth, and really make that determination as we get closer to that April 30th deadline.
When you say data, does that mean cumulative? You're looking at it, you're expecting it to come in X day, and that's when you make a decision, or is it a day-to-day decision?
It's really, how does that data change over time? So for example, if we saw the number of cases all of a sudden start dropping off dramatically, that would tell us one thing. If we saw the cases kind of flatline, that might be another thing. So, but you really can't look at one day. You have to look at this over a period of time. And so we're just waiting for more of that data to come in. So it's not a point in time kind of thing. It's really a cumulative data and what's the trends.
We have time for a couple more questions.
Couple more questions, yeah.
Last week you mentioned, or you commented on the high concentration of cases in Hall County. Could you do something similar for Kimball? Because you have metros like Lincoln, Omaha, and Grand Island, and it's a much higher rate per person in those counties in that county.
Yeah, so with regard, the question was, hey, we had the high rate of positivity testing in Hall County and Grand Island. We just deployed people there to do more testing. And then the question was about, what about Kimball? We actually deployed people to Kimball, and at least my understanding, the preliminary test that came in, we tested 50 people, and I think the only person who tested positive was one person we already knew had tested positive before. So we thought we had maybe a reason to go in and do some more testing. We did. We didn't really find anything there, but that's the kind of way we'll handle it going forward. If we think there's places we need to deploy people, our testing teams to the state, we'll continue deploying them around the state to get that data. One more question. Yeah, John.
Question on statewide testing. Once people test positive for coronavirus, are they later tested to see if they're negative, or are they just assumed negatively?
So if you are tested positive for coronavirus right now, what we know you have to do is you have to, go into that isolation, right? So you got to go home and stay away from people for 14 days plus 7 days after you are no longer symptomatic. So there's no need to test that person again. That person just needs to go home, stay there till they get better, and wait 7 days, and then go out again. And Dr. Anto, is that accurate? Okay. You want to come up and say something else? Great. All right, Dr. Anto, you're going to get the last word here.
If a patient is hospitalized with COVID positivity and then recovers but needs to go to like a nursing facility or something, then we would probably test before they are admitted to the skilled nursing facility.
Do you know roughly how many times that's happened?
Yes, I don't know the numbers really, but probably whenever a patient gets hospitalized and goes to the nursing facility, I don't know the exact number for that.
Well, again, folks, thank you very much. I appreciate you taking the time again to be here today to talk about the things the state is doing to prevent the spread of coronavirus here in Nebraska. Again, remind everybody about our 6 rules. Stay home, go to work, socially distance, shop once a week, help kids, help seniors, exercise daily. Those are our 6 rules to help keep Nebraska healthy as we focus on these last few weeks here in April. Thank you again to everybody who's making it a personal mission to be able to slow the spread of coronavirus here in our state. It takes everybody to be a part of this. We appreciate all your work, and we will see you all back again here tomorrow at 2 o'clock. Thanks.